Logging onto the Omnicell cabinet. Let's talk about how to log on to an Omnicell cabinet. You can use your user ID and password or fingerprint. In this section, we will briefly talk about each option. Log on with your user ID and password. Initially, you'll be required to log on with your user ID. To do so, ask your system administrator to issue you with a user ID. Then attempt to access the ColorTouch system by typing in your user ID. The system will prompt you to enter a new password. Simply follow the on-screen prompt to create your new password. Click Show Me to see how it's done. Your system administrator will add your user ID to the database so that you can begin to use the Omnicell cabinets. Enter your user ID and press Enter. You are prompted to enter a new password. Retype your password. Touch the Change Your Password button. When you are successfully logged in, your name displays at the bottom of the screen. When you are done, always touch Exit to log out. Click Close to continue. Patient lists. Let's have a closer look at how to remove medications for your patients from the Omnicell cabinet. After you log onto the cabinet, you will see a patient list. There are three types of patient lists. Global list, which includes all patients. Local list, which includes only patients in your work area. Partial dose list, which includes only patients with undocumented medication issues. All lists are arranged alphabetically by patient last name. The Sort by Room button allows you to sort patients by room. Occasionally, you may need to manually add a new patient. Before adding a patient, always verify that the patient is not on the global list. To manually add a new patient, press the Add New Patient button. Enter the patient's unique identifier if you know it. This may be the NHS number, spell number, or facility identifier. If you do not know it, enter as much information about the patient as possible, such as date of birth, etc. Click Show Me to see how it's done. If the patient's name does not appear in any of the patient list, you will need to add the patient to the system. Touch the Add New Patient button. You will be prompted to enter the new patient information. Our patient's last name is Abram. The first name is Joe. Enter the patient's assigned account number if you have access to it. If not, type as much identifying information as possible, for example MRN or medical record number, date of birth, etc. Touch the Add New Patient button. The patient screen appears. The patient was added to the system. Touch the Patient Care button to return to the patient list. The patient was added as a temporary TMP patient to the patient list. Click Close to continue. Tabs for removing medications. You begin the process of removing items from a patient's record. At the bottom of the patient record are tabs. You will begin removing medications from the stocked meds list. This list contains all items stocked in this cabinet. Note that items stocked in supply zones do not display on this list. After you select items from the stocked meds list, you can press the Display Meds to Remove tab to view a filtered list of the items you have selected for removal. Let's look at how to remove a medication from the cabinet. Click Show Me to see a demonstration. Remove a single medication. In this demonstration, we will be removing paracetamol for patient Sean Brock. After logging in, select the patient. The patient's screen appears. Press the Remove Drugs button. The stocked meds list appears. Type PARAC. The letters appear at the bottom of the screen. Select paracetamol 500 mg tablets from the list. A dispensing alert may appear. If it does, read it and either enter an appropriate response or acknowledge it and press OK. The Remove Drugs screen appears. Enter a dose of 1000 mg, which the system calculates to be 2 tablets. When done, press OK. The quantity to remove displays on the left of the screen. Touch Remove Now. At this point, if the item is a controlled drug or has been deemed to require 2 users to access it, the screen shown will display. You have 3 choices at this point. You can either continue with the process, cancel the item requiring a witness, or cancel all items. Follow the on-screen prompts and guiding light to locate and remove the medication. Access the drawer and bin to remove the medication. When you open a drawer or door to access an item requiring a witness, the witness will be required to log in at this point. If the item is in a lidded bin, the lid will not unlock until the witness has completed their part of the transaction. As you can see from the screen, the witness at this point can either use their fingerprint to witness the transaction, or enter their user ID followed by the Enter key, and their password followed by the Enter key. Access the required items and close the drawer. Press Exit to log out of the system. Note: to remove more than one medication at the same time, repeat the process of typing in the drug name and selecting the drug prior to pressing the Remove Now button. Click Close to continue.